Note: add the August sign on Minor Issue 1. HIV policy as a domestic priority. The Academy applauds President Biden's delivery on his promise to ban discrimination in healthcare on the basis of gender identity and sexual orientation. Protecting transgender Americans' access to health care and coverage, including medically necessary gender-affirming care, provides a vital step to ending the HIV epidemic in this country. The Academy also celebrates the largest ever replenishment of the Global Fund to fight HIV/AIDS, TB, and malaria, with donors pledging $15.7 billion. Major issue: SH Institute Academy to host Sexual Health Institute at USCHA. The Academy will host a Sexual Health Institute at USCHA this year to equip participants with the framework to successfully negotiate this politically charged climate. Recent court decisions, the rise in STIs, and legislative attacks on healthcare have created the perfect storm created between providers and the people they serve. This institute will focus on centering sexual health as a part of primary care is an important response to this threat environment and emphasize the advocacy and intentionality by sexual health care providers need in order to regain lost ground. Through interactive discussion, participants will share advocacy best practices for overcoming structural challenges and getting providers off the sidelines. Participants of this institute will also learn how the decisions in Dobbs and Braidwood have affected the future of healthcare access, particularly sexual health care. How state and federal policies impact health equity in general and sexual health care access in particular for all people, especially those without private insurance. How the Academy's work to develop its sexual health curriculum through its internal validation study helps providers respond to current attacks on access. The Institute is also designed to launch a series of conversations between advocates, providers, and those they serve. If you'd like to stay in the loop, please send email to chauncey@am.org. Minor Issue 2, Policy and Clinical Practice, Black in the South, HIV Awareness, Survivors, and NOLA Upcoming Events, #SHAAD. On Tuesday, August 20, 2024, organizations across the southern U.S. commemorated the 6th Annual Southern HIV/AIDS Awareness Day. Southern AIDS Coalition launched this Awareness Day in 2019 for individuals all over the nation to join a movement to raise awareness, erase HIV-related stigma and discrimination, and to advocate for new and necessary resources and solutions to stem the tide of HIV in the South. We heard a panel of Southern leaders from Memphis, Tennessee, Baton Rouge, Louisiana, and Jacksonville, Florida discuss the HIV stigma exists in communities and strategies to end it. Upcoming event, BLK in the South Summit. The Academy is looking forward to the BLK in the South Summit, a one-day event designed to address HIV and provide innovative ideas, concepts, and frameworks for collaborative efforts to end the epidemic in the Black community in the South. Upcoming event, Xavier University, New Orleans, Louisiana. In celebration of Southern HIV/AIDS Awareness Day, we are also happy to share an upcoming event from George Nawaz, Farm D, BCPS, AHIP, our local member in New Orleans. In Pursuit of Justice, Navigating the Legal Landscape of HIV in Louisiana. This will be a live event hosted on the campus of Xavier University. AIDS/VU HIV in Black Communities, PrEP in Black America, a new approach to biomedical HIV prevention advocacy, Minor Issue 3, Community Collaborations and Sign-on-Sign-ons, PrEP Equity 1. July 29th, Stop Insurer Barriers to PrEP. The Academy joined Yale HPTN 096 on a sign-on letter to urge CMS to take immediate action to include PrEP in the ACA risk adjustment model, as part of the Notice of Benefit and Payment Parameters 2026 rule to properly reward and incentivize insurers to increase PrEP uptake. Stop Insurer Barriers to PrEP 2. July 17th, to CMS eliminate cost sharing. The Academy joined 62 organizations in a sign-on letter requesting CMS to issue updated guidance to insurers, based on the most recent USPSTF recommendation, namely, new plans should be required to cover long-acting PrEP and ancillary services without cost sharing, prohibit prior authorizations, and include all future FDA-approved PrEP drugs. PrEP update request to CMS sign on final 17.17.24.pdf appropriations 3. July 15, Safe States Alliance FY25 opposing cuts to CDC budget. The Academy was one of 164 organizations representing the Injury and Violence Prevention Network and allied organizations that voiced their opposition to the proposed cuts outlined in the FY25 Labor HHS Appropriations Bill, which would slash the CDC's funding by 22%, include the elimination of the National Center for Injury Prevention and Control. 4. June 21, the Academy joined the NDD coalition sign-on in calling on Congress to reject arbitrary funding levels for FY25 and fund at a level that recognizes rising costs and need for investments and keep poison pill policy riders out of the package.